Hey guys, so today we'll be discussing sterile line change procedures for the NICU. So first up, gather all necessary tubing supplies, 2 pairs of sterile gloves, and a sterile drape. Next, do your 2-person verification of the new TPN or fluids, lipids, and any additional meds or drips to be hung. Then, clean your workspace surface with sandy wipes and let dry. Perform hand hygiene and don clean gloves. Set up a clean field on an appropriate work surface using one of the sterile drapes. Open all clean items onto the field, which would include your lipid syringe, a 10 ml saline flush, your TPN or IV fluid, your TPN and IV fluid tubing, and any additional meds or drips. Set up your sterile field using the second sterile drape on an appropriate work surface near your clean field. Open all necessary tubing and supplies onto the sterile field without contaminating the field. This should include your trifuse, your lipid tubing, your lipid filter, TPN filter, med tubing, claves, 4x4s, 2x2s, and any extras needed for additional fluids. Open your sterile gauze packet and place it on the edge of the sterile field and underneath your sterile drape. The next step is to spike your TPN or IV fluid bag and then clamp the line. It is important to remember not to prime your TPN or IV fluids at this point to maintain consistency with priming the lines. This will also help to ensure that we avoid med errors. Once you are done spiking your IV fluids, you want to remove your clean gloves and perform appropriate hand hygiene. Keep in mind that when you set up your sterile gloves, it's easier to place them on the wow. Additionally, pick a half size larger than your usual size to make it easier when donning 2 sets of gloves. Set the larger pair on the top of the wow underneath the screen and set your smaller pair on the keyboard to make for easy transition and to avoid contamination of the gloves. As soon as you have on both sets of sterile gloves, you are ready to move on to assembling your sterile lines. First up, attach a clave to the med port on the trifuse. Remember, this is always the port closest to the patient. Then, attach your 0.3 ml med tubing to the med port clave on the trifuse. Attach a clave to the med tubing closest to the 10 ml saline flush. Next, attach both filters, the TPN and lipid filter, to respective ports on the trifuse. Attach your 2 ml lipid tubing to the lipid filter, and attach a clave to the end of the lipid tubing closest to the lipid syringe. If you have trouble remembering which is which, keep in mind blue to white or white to blue. The TPN tubing is blue and goes to a white filter. The lipid tubing is white and goes to a blue filter. Once the lines are assembled, you are now ready to attach them to their appropriate source. Using the hand closest to your clean field, use a 4x4 to pick up your lipid syringe, and in the opposite hand, use a 2x2 to remove the cap from the lipid syringe and discard of that 2x2 and cap. Connect your lipid tubing to your lipid syringe, and then return the syringe to the clean field and discard of the 4x4. Use another 4x4 to pick up your 10 ml saline flush, and use a 2x2 to remove the cap from the saline flush. Then discard of that 2x2 and cap. Connect your med tubing to your saline flush syringe, and return the syringe to the clean field and discard of that 4x4. Using one sterile gloved hand and one clean hand, use a 2x2 to remove the cap from the TPN tubing. Using your sterile hand, you can easily disconnect the cap on the TPN filter and then connect the TPN tubing to the TPN filter. Leaving the end cap on, place the tip of the trifuse in the sterile gauze packet at the edge of your field and crinkle shut. Now you are ready to prime your lines. It is important to keep in mind when priming your lines that you want to use your fluids or medications that you have the most of first to prime the line. In this case, and in most cases, it will be TPN or your IV fluids. You want to prime the TPN or IV fluids all the way to the end of the trifuse. Then move on to your med line and prime that all the way to the end of your trifuse. Lastly, take your lipids and prime it all the way to the end of the trifuse. Once you have completed priming your lines, you're going to want to hang your fluids and plug them into the appropriate pumps and program them according to MD orders. Then you will start your fluids when ready, and note that this should be before connecting your lines to the patient. Slightly ajar your isolette door and move the gauze packet with the tip of the trifuse into the isolette and secure it in the side port. Once you close the isolette doors, make sure to open your portholes. Next, you will return to your sterile field and work on opening your alcohol pads. It's easier to sterilely remove the alcohol pads if you rip down the center of the packaging and in the corner and gently shake until the alcohol pad falls onto the sterile field. Then you will remove your outer gloves and with your still sterile inner gloves, pick up 1 2x2 and 1 alcohol pad. Keep in mind that the hand with the alcohol pad will grab the clave, while the hand with the 2x2 will grab the old tubing. Turn and stick your hands sterilely back into the isolette portholes and remove the old tubing. Then do your scrub the hub, which is a 15-second scrub and a 15-second dry. Once this is complete, remove the tubing from the gauze packet and connect the new tubing to the patient. Once this is done, you have officially and successfully done your sterile line change. Proceed to doing your last 2-person verification, and keep in mind that this should include that it is the right patient, tubing, route, order, settings, and site. Once that is done, replace the 10 ml saline flush syringe with a Curos green cap and ensure to label all tubing with appropriate labels and date to be changed. An example, if the lines are hung on Friday, the date sticker should be Saturday with that date and time.